Hi, welcome to Socialpost Health Channel viewers. I, Dr. Chava Anjaneyulu, Chairman and Senior Consultant ENT Surgeon for Asian ENT Care Center located in Panjagutta, Hyderabad. Many people now they are feeling sound in the ear in absence of external sound. That we call it as a tinnitus. This is abnormal sound in the ear. Why this abnormal sound is happening in the ear? What is the main reason? Many people, now the common reason is continuous use of phones, headset, Bluetooth and continuous noise exposure to any machines. Sometimes it may happen due to loud noise exposure suddenly, especially in the DJ music in closed area. If there is a loud noise, it also causes this tinnitus problem. And sudden exposure to cold weather, if you go chilled weather, sometimes this tinnitus will happen. Sometimes if you have any trauma to the ear, physical damage, it also causes the tinnitus. Mainly tinnitus happens due to disturbance in the hearing mechanism or hearing path, that is either external ear canal, middle ear canal or inner ear. External ear, it is very easy to treat if it is due to wax accumulation or closure of the external ear canal. Just you open that external ear canal, by removing the wax, your tinnitus will go down. You will get very good recovery. If due to infection in the middle ear, most of the times with the cold, fullness in the ear, you will treat that infection with antibiotics, antihistaminics, decongestants. Once infection subsides, inflammation subsides, hearing will improve and tinnitus will subside. Main problem comes damage to the inner ear cells, that is cochlear hair cells, cochlear nerve, vestibular cells. If there is a damage to the cells, if you delay in treatment, to get back is very difficult. Commonly this will happen due to chronic noise exposure, either due to phone and headset or machines, continuous use of earpads for the entertainment, professional and educational use, and continuous noise exposure, especially in music environments, cold weather exposure. And if you have diabetes and hypertension problem or obesity problem, hyperlipidemias, there is a more chance of tinnitus with these predisposing factors. Because with the diabetes, hypertension, hyperlipidemias, other systemic problems, the inner ear get inflamed and the blood vessels will shrink and the cells also go into early degenerative change. With these diseases, if we expose to the cold weather, noise exposure, if you use more phones, it will enhance your damage there in the cells and nerves. It will cause the tinnitus, hearing loss and vertigo. Whenever you have these problems, immediately get a cochleovestibular evaluation. There we know what is the main damage happened where. Cochlear hair cells, cochlear nerve fibers, vestibular cells or vestibular fibers, and this test will help you to diagnose the problem, disease also, like Meniere's disease or only cochlear hair cells degeneration or sometimes both together. And if the patient has any pain along with the tinnitus, and in elder people it is always best to do the radiological investigation, that is MRI or CT, to rule out rare problems like tumors. If you have tinnitus problem, that is abnormal sound in the ear in absence of external sound, that we call it as an illusion. Contact Asian ENT Care Center located in Panjagutta, Hyderabad. They will do all your test, investigations, evaluation in cochleovestibular lab, and they will provide the treatment either with medicines, injections. Sometimes nowadays platelet-rich plasma injections are giving very good results in some patients when there is a little bit damage or partial damage to the inner ear. For further updates, subscribe Socialpost Health Channel YouTube.